We know that a fit workforce helps the economy, and in order to have a fit workforce, we really need three things to happen. We need our health professionals to be aware that good work is good for your health, and to be sure that they can refer people for early intervention. That usually takes place at a family doctor level, and it may be a referral to a hospital, or it may be that the GP can manage it, him or herself. You also need very good employers who are aware of and will act appropriately if somebody has a chronic condition, and will make it possible for people to stay in work or return to work with a chronic condition or after perhaps an operation. We also need governments to be really aware of the importance of a fit workforce to the economy, and this requires cross-government collaboration, and a very wide cross-government collaboration, not just the Department of Health, Department of Work and Pensions, but also the Department of Business and possibly the Department of Education, and of course the Treasury, and in our country, the Cabinet Office. The World Health Organization has helped us recently by producing its action plan for the prevention and control of non-communicable diseases. This was adopted in September 2016 and certainly talks to the problem of musculoskeletal disorders and their effect on people's ability to work or work well. It's truly important with musculoskeletal disorders, which cause such a very big drain on the economy. For Europe, it is something like 240 billion per year. It's really important that we get early and correct diagnosis, and then that early diagnosis enables a truly early referral to the right professional so that the person's health and well-being can be restored. Hopefully they can remain in the workplace while treatment is happening, and if not, they can be returned to the workplace as soon as possible. In order to help this really important issue, the Fit for Work Global Alliance has been busy finding practical tools. It's really important that an organisation knows what to do. It's all very well saying we need people to be fit in work, but you need to give people toolkits, and that is exactly what the Global Alliance has been doing. This is an early interventional toolkit, so that whoever is looking after someone with one of these conditions will have a roadmap of what might be done. We believe that the early interventional toolkit can make a considerable difference to our partners and to the countries in which it could be used. We, along with our partners, and that's the partners that we're working with in Bratislava, and in the presentation of the early toolkit at a summit there, the Slovakian government have been supportive, and the Slovakian Patients Association are all aware of and have taken part in the formation of this toolkit. We hope that it will be very widely used. It provides a pathway of how to do it. There's a great deal of guidance there so that no one need be lost in using this toolkit. And at the summit, there was also a call for action. This call for action is a call for action to governments. Governments need to be aware of the value that can be gained from early intervention in musculoskeletal conditions. Of course, early intervention is valuable in all chronic conditions. We want them to work together to develop joint budgets between the departments of health and their departments of labour or work and pensions, and we want them to develop policies and mechanisms for delivering this really important issue of early interventions for a group of conditions which is one of the widest reasons why people are not in the workplace and accounts in Europe for 60% of the sickness absence that we see. And this is a huge number and something that really needs addressing at a government level. In July 2017, the trio presidency comes into existence. This is a presidency of Estonia, Bulgaria and Austria, and we very much want that trio presidency to follow the lead of the Slovakian presidency in supporting and taking forward this early intervention agenda, and we will be calling upon them and hopefully working with them to achieve this end.